Our next inductee is Rena Margulis. Rena developed Tandem Point SM therapy, a bridge between Eastern and Western bodywork. Tandem Point therapy integrates Chinese acupressure with trigger point therapy, fascial release, and stretching. No trigger points are too painful for treatment with Tandem Point therapy, and several trigger points can be successfully released in a single session. Since 1998, Rena has taught continuing education classes in Tandem Point therapy, focusing on scar tissue release, trigger point release, and assessment and treatment of chronic myofascial pain, especially back and hip pain, knee pain, and shoulder pain. In March 2000, Rena delivered a 90-minute presentation on Tandem Point therapy during physical medicine and rehab ground rounds at the National Institute of Health in Bethesda, Maryland. Giving back to the profession, Rena led the statewide petition campaign against the New Jersey massage and bodywork tax. During the process of passing New Jersey's state licensing law, Rena served as the secretary of and the ABMP representative to the New Jersey Coalition of Massage, Bodywork, and Somatic Therapies. Rena has been a practicing bodywork therapist since 1993 and currently maintains a private practice in Haddonfield, New Jersey. She has a bachelor's degree from Smith College and a master's degree from Stanford University. She is nationally certified in Therapeutic Massage and Bodywork and is nationally certified in Asian Bodywork Therapy.
Thank you. Thank you, Judy. Thank you, Mike, for this honor and for this opportunity. I had considered talking about the value of therapeutic bridges because Tandem Point therapy is a bridge between Eastern bodywork and Western bodywork. And the fact that few people have started this kind of bridge was brought home to me when I was at a presentation by Janet Kahn at the NIH, where she showed a chart of bodywork, and she had Eastern bodywork, and she had Western bodywork, and more boxes below each, and I realized that I did not exist. Anyway, I appreciate Mike establishing that I do exist. But that is not, in fact, the most important thing that I can talk to you about today. There's another bridge that I think is critically important, and that is a bridge of understanding and knowledge between you, all of us who treat myofascial pain, and the public who is suffering it. I don't know about you, but when I see a new client, the vast majority of them, they have no clue as to the cause of their pain, and what they are frequently doing is exactly the wrong thing, making their pain worse. I have a vision for a series of videos that would explain in layman's terms what is the nature of myofascial pain, what is the cause, what is the treatment, how to prevent it. This would not include just the role of trigger points, but the role of scar tissue. We've heard other people mention scar tissue, but in my experience, this is one of the most critical perpetuators of chronic pain. I got to see a man, he came in, and he said something to me that you may have heard from your clients, a terrifying thing. He said, Rena, he's a Philadelphia Phillies fan. He said, you are my Brad Lidge, you are my closer. After you, I don't have anybody else to go to. And this man came in with daily pain, 8, 9, very depressed. I said to him, if I can't help you, I know other people, don't stop with me. And his pain was caused by his scar tissue. He had had kidney surgery, he had had appendectomy surgery, and today he's a happy guy. You would never know that this was the same man. Another feature that people need to understand, and I'm so delighted that there are so many women here and I can talk about this, is the role of compression in the fascia as a source of pull in the fascia, giving you distant pain. And over again, I find women and even young girls who have serious chronic pain caused by their underwire bras that are putting compression on the fascia, leading to distant pulls. The worst case of this was a woman who had terrible pain going down her arm and had been told she needed neck surgery. What she needed was to take the underwire out of her bras. People have no clue. Anyway, I'm looking for help with this project. Especially I'm looking for people who have video and editing skills, and most especially I'm looking for someone who can do medical illustration as computer graphics. If any of you have skills like this and would like to contribute to a project that would educate the public, one of the goals of the World Massage Festival, I can be found at tandempoint.com. Thank you very much, and thanks to my friend Pam, who left her 19 grandchildren to come here and participate in this.